the incidence of post-operative pancreatic fistula, it is around 5 to 30% after PD. So, I mean, beside the morbidity, it also contributes to the mortality and longer hospital stay. If you are dealing with the HPV surgery, then we all of us know that if the patient develops a POPF, the course become prolonged, the hospital stay become prolonged, and the complications are high. So initially, it was proposed or hypothesized that the pancreaticogastrostomy (PG), the pancreatic enzymes are secreted the acidic environment of the stomach, and that they will not be activated because for activation they need a while. So there will be less chance of the POPF, but the literature has not, shown any. But has not supported this fact, and the leak rate after PG and PJ is equivalent.